And I need to listen to your lungs a little bit. You sound a little congested.
Before performing oral pharyngeal suctioning,
Take a deep
observe the
breath.
patient for signs and symptoms of the need for suctioning.
Sit you up a little bit.
Then position him in a semi-Fowler's or Fowler's position. And, if ordered, check his oxygen saturation. If needed, place a towel, cloth, or paper drape across his neck and chest. Put on clean gloves along with a mask or face shield if required. Now prepare the equipment. First, fill a cup or basin with about 100 milliliters of sterile water or sterile saline. Second, turn on the suction equipment and set the vacuum to a medium level, or at the level designated by the physician's order or agency policy. Third, connect one end of the connecting tubing to the suction machine and the other end to the suction catheter. And fourth, suction a small amount of water or saline to make sure the equipment is working properly. If the patient has a nasal cannula, leave it in place. However, if he has an oxygen mask, remove it but keep it near his face. Now insert the catheter into the patient's mouth, sliding it along the gum line to the pharynx. While applying suction, move the catheter around his mouth. To decrease the invagination or infolding of the oral mucosa, place and remove your finger over the suction port or catheter and limit suctioning to 10 to 15 seconds each time. When the secretions are cleared, encourage the patient to cough. If he was using an oxygen mask, replace it. Now suction water or normal saline through the catheter until the connecting tubing is cleared of secretions. With the suction turned off, discard all the supplies appropriately. For example, put the catheter in your gloved hand and pull your glove off inside out over the catheter. Then dispose of them together. Wash the patient's face and offer oral hygiene if needed. Then assess the patient's respiratory status.
Are you breathing easy?
If needed, repeat the procedure. And if his status does not improve, try using a standard catheter for tracheal suctioning.
Mr. Raymond, are you feeling better?
As part of your follow-up care, compare the patient's respiratory status and oxygen saturation to your findings before suctioning.